Question 1. The investigation demonstrates that a registered behavior technician, RBT, is implementing a discrete trial training program to teach a client to identify different types of fruit. The current discriminative stimulus, SD, for identifying an apple is a picture of an apple. The client has begun to consistently point to the picture of the apple when presented with it, but has also started to express a preference for a banana, often reaching for a banana picture even when the apple picture is the correct target. The RBT is considering changing the SD to a real apple to see if this increases the client's engagement and accuracy, but has not yet discussed this with the Supervising Board Certified Behavior Analyst, BCBA. What is the most appropriate course of action for the RBT? Option A. Continue presenting the picture of the apple as the discriminative stimulus, as this is what was outlined in the treatment plan. Option B. Consult with the supervising BCBA to discuss the client's preference and the potential modification of the discriminative stimulus. Option C. Immediately change the discriminative stimulus to a real apple, as this may increase client engagement and accuracy. Option D. Ask the client to choose between the apple picture and the banana picture, regardless of the target behavior. The correct answer is B. Consult with the supervising BCBA to discuss the client's preference and the potential modification of the discriminative stimulus. Explanation. This scenario presents a professional challenge because it involves a potential conflict between the client's perceived needs and the ethical and regulatory requirements for providing effective behavior intervention. The RBT must navigate the ethical imperative to respect client autonomy and preferences while upholding the professional standard of care, which dictates that intervention should be based on evidence and appropriate assessment. The core of the challenge lies in ensuring that the intervention is truly beneficial and not simply a response to an arbitrary preference that could undermine the learning process or lead to ineffective outcomes. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and ethical process. By consulting with the BCBA, the RBT adheres to the principle of supervision and collaboration, which is a cornerstone of ethical practice in behavior analysis. This consultation ensures that any modification to the intervention, particularly regarding the discriminative stimuli, is clinically sound, aligned with the client's treatment goals, and supported by the principles of behavior analysis. This approach upholds the BAC ethical code, which mandates that RBTs work under the supervision of a BCBA and implement interventions as designed by the BCBA. It also ensures that the integrity of stimulus control is maintained, meaning the stimulus reliably signals the availability of reinforcement for a specific behavior. An incorrect approach that involves unilaterally changing the discriminative stimulus without consultation is professionally unacceptable. This violates the ethical requirement for RBTs to implement behavior analytics services under the supervision of a BCBA. It bypasses the clinical judgment of the BCBA, who is responsible for designing and overseeing the treatment plan. This could lead to a breakdown in stimulus control, where the new stimulus no longer reliably predicts reinforcement, thus hindering the client's progress and potentially reinforcing an inappropriate behavior or preference. Another incorrect approach, that of simply ignoring the client's preference and continuing with the original stimulus, fails to acknowledge the importance of client assent and rapport, which are crucial for treatment adherence and effectiveness, even if the original stimulus is technically correct. While not a direct violation of implementing the plan, it misses an opportunity to enhance the therapeutic relationship and potentially improve the intervention's efficacy through collaborative adjustment, which is implicitly encouraged within ethical practice. The professional decision-making process for similar situations should involve a clear understanding of the RBT's scope of practice and the hierarchy of supervision. When faced with a client preference or suggestion that deviates from the current intervention plan, the RBT should first assess the request in relation to the treatment goals and the principles of behavior analysis. If the request seems potentially beneficial or if there's a concern about the current stimulus's effectiveness or the client's engagement, the RBT's immediate and primary action should be to consult with their supervising BCBA. This consultation allows for a professional evaluation of the proposed change, ensuring that any adjustments are evidence-based, ethically sound, and in the best interest of the client's progress. The RBT should document the client's preference and the subsequent consultation with the BCBA. Question 2. Upon reviewing a client's behavior intervention plan, an RBT encounters a target behavior described as feeling frustrated. The RBT needs to determine if this is an appropriate target behavior for direct, objective measurement. Which of the following best describes the nature of feeling frustrated in the context of ABA measurement? Option A. It is a non-observable internal state that requires inference based on observable behaviors. Option B. It is a private event that is directly observable by the client but not by an external observer. Option C. It is an observable behavior that can be directly measured through specific physical actions. Option D. It is a subjective experience that is inherently unmeasurable in an ABA context. The correct answer is C. It is an observable behavior that can be directly measured through specific physical actions. Explanation. This scenario presents a professional challenge because it requires the registered behavior technician, RBT, to accurately differentiate between observable and non-observable behaviors, a foundational skill for effective data collection and intervention planning. Misclassifying a behavior can lead to inaccurate data, inappropriate intervention selection, and ultimately ineffective treatment for the client. The RBT must apply the principles of applied behavior analysis, ABA, as outlined in the BAC Registered Behavior Technician Handbook, which emphasizes objective measurement. The correct approach involves identifying behaviors that can be directly seen, heard, or otherwise detected by an observer. This aligns with the BAC ethical code and standards of practice, which mandate objective and reliable measurement. By focusing on observable behaviors, the RBT ensures that data collection is consistent and can be independently verified, which is crucial for demonstrating treatment efficacy and for ethical accountability. An incorrect approach would be to include or focus on internal states or subjective experiences that cannot be directly measured. For instance, inferring a client's internal emotional state without observable behavioral indicators is not scientifically sound within the RBT scope. This violates the principle of objective measurement, as it relies on interpretation rather than direct observation. Another incorrect approach would be to confuse private events, which are technically observable by the individual experiencing them, but not by an external observer, with truly non-observable constructs. The RBT's role is to measure behaviors that are publicly verifiable. The professional decision-making process for similar situations involves a systematic approach. 1. Define the target behavior clearly and operationally. 2. Ask, can I directly observe this behavior happening? 3. If the answer is yes, it is likely observable. If the answer requires inference or relies on the client's self-report of an internal state, it is likely non-observable for the purpose of external measurement. 4. Consult the BAC RBT Handbook and ethical guidelines for clarification on measurement and definition of behavior. 5. If unsure, seek supervision from a board-certified behavior analyst, BCBA. Question 3. Stakeholder feedback indicates that parents and caregivers are experiencing significant time constraints, making lengthy, unstructured interviews challenging. The RBT needs to gather information on the frequency and intensity of challenging behaviors, as well as potential antecedents and consequences, to inform the development of an intervention plan. Which indirect assessment method would be most appropriate to optimize data collection while respecting stakeholder time and ensuring comprehensive information? Option A. Scheduling lengthy, open-ended interviews with each parent and caregiver individually, allowing them to freely discuss any behaviors they deem important. Option B. Administering a standardized, behavior-specific questionnaire that can be completed independently by parents and caregivers, followed by a brief, targeted follow-up interview if clarification is needed. Option C. Relying solely on informal, brief conversations with parents and caregivers during drop-off and pickup times to gather information. Option D. Asking parents and caregivers to keep detailed daily logs of all behaviors observed, without providing specific guidance on what to record. Correct answer is B. Administering a standardized, behavior-specific questionnaire that can be completed independently by parents and caregivers, followed by a brief, targeted follow-up interview if clarification is needed. Explanation. This scenario presents a common challenge in applied behavior analysis, balancing the need for comprehensive information with the practical limitations of data collection and the ethical imperative to involve stakeholders appropriately. The registered behavior technician, RBT, must navigate the preferences and availability of various individuals who interact with the client, ensuring that the chosen indirect assessment method is both effective and respectful of their time and expertise. The RBT's primary responsibility is to gather accurate and relevant information to inform behavior intervention plans, adhering strictly to the BACP RBT ethics code. The correct approach involves selecting an indirect assessment method that is structured, allows for consistent data collection across different informants, and is feasible given the stakeholders' schedules and communication styles. Utilizing a standardized questionnaire or a semi-structured interview protocol ensures that key areas of behavior are systematically explored, minimizing the risk of anecdotal or biased reporting. This aligns with ethical practice by promoting data-driven decision-making and ensuring that interventions are based on a thorough understanding of the target behaviors and their maintaining variables, as outlined in the BACP RBT Ethics Code, particularly regarding the importance of accurate assessment and professional competence. An incorrect approach would be to rely solely on informal conversations without a structured framework. This risks gathering incomplete or subjective information, potentially leading to an inaccurate functional assessment and ineffective interventions. Ethically, this fails to meet the standard of professional competence and due diligence in assessment. Another incorrect approach would be to exclusively use a method that is overly burdensome for stakeholders, such as requiring lengthy, open-ended interviews from multiple individuals simultaneously without prior arrangement. This could lead to stakeholder fatigue, resistance, and ultimately, a lack of participation, compromising the quality of assessment and potentially violating ethical principles related to respecting the rights and dignity of clients and their support systems. Professionals should approach this situation by first identifying all relevant stakeholders who have regular contact with the client. Then, they should consider the most efficient and effective ways to gather information from each stakeholder, taking into account their availability and preferred communication methods. This might involve offering a choice between a brief, structured questionnaire or a scheduled, focused interview. The RBT should clearly explain the purpose of the assessment and how the information will be used to benefit the client, ensuring transparency and fostering collaboration. This systematic and stakeholder-centered approach ensures that the assessment is comprehensive, ethical, and practical. Question 4. Examination of the data shows that during a structured observation designed to assess a client's ability to initiate social greetings, the client becomes visibly distressed, avoids eye contact, and repeatedly states, "I don't want to do this," when prompted to greet a peer. The Registered Behavior Technician, RBT, has been trained to administer this specific assessment as part of the client's treatment plan. What is the most appropriate course of action for the RBT? Option A. Pause the assessment, comfort the client, and immediately consult with the supervising BCBA to discuss the client's distress and determine the next steps for assessment or intervention. Option B. Decide that the assessment is no longer appropriate for the client at this time and unilaterally discontinue it, focusing on other skill areas. Option C. Inform the client that the assessment is mandatory for their progress and proceed with the assessment, gently redirecting them to engage with the peer. Option D. Continue with the assessment as planned, documenting the client's verbalizations and non-compliance as data points to ensure the integrity of the assessment protocol. The correct answer is A. Pause the assessment, comfort the client, and immediately consult with the supervising BCBA to discuss the client's distress and determine the next steps for assessment or intervention. Explanation. This scenario presents a common ethical challenge for registered behavior technicians, RBT, when assessing skills, particularly in communication and social domains. The challenge lies in balancing the need for accurate and comprehensive data collection with the client's right to dignity, comfort, and privacy, especially when the assessment might elicit sensitive or challenging behaviors. The RBT must adhere to the BACP RBT Ethics Code, which emphasizes client welfare, competence, and integrity. The correct approach represents best professional practice because it prioritizes the client's immediate well-being and comfort while still aiming for effective assessment. By seeking supervision and collaborating with the BCBA, the RBT demonstrates adherence to the principle of providing services only when competent and within their scope of practice. This also aligns with the ethical obligation to maintain professional boundaries and seek guidance when faced with complex situations that could impact client progress or well-being. The RBT is not equipped to independently alter assessment protocols or make clinical judgments about the necessity of a specific assessment in the face of client distress. This requires the expertise of a BCBA. An incorrect approach that involves proceeding with the assessment despite the client's clear distress and resistance, would be a direct violation of the client's right to dignity and respect. It could also lead to inaccurate data, as the client's responses would be influenced by their discomfort rather than their true skill level. Furthermore, it demonstrates a lack of clinical judgment and an inability to adapt to the client's needs, potentially causing harm. Another incorrect approach, such as unilaterally deciding to skip the assessment entirely without consultation, bypasses the established assessment plan and the BCBA directive. This undermines the integrity of the treatment plan and the RBT's role as an implementer of that plan. It also fails to address the underlying skill deficit that the assessment was intended to measure, hindering progress. Finally, an approach that involves documenting the client's distress but continuing the assessment without any attempt to mitigate it or seek further guidance would be ethically problematic. While documentation is important, it does not absolve the RBT of the responsibility to ensure the client's comfort and to seek appropriate support when faced with challenges that impede effective service delivery. The professional decision-making process in such situations should involve 1. Recognizing and acknowledging the client's distress. 2. Immediately pausing the assessment or intervention that is causing distress. 3. Consulting with the supervising BCBA to discuss the observed behavior and seek guidance on how to proceed. 4. Collaborating with the BCBA to modify the assessment approach, environment, or timing if necessary, or to determine if the assessment is still appropriate. 5. Documenting the client's behavior, the steps taken, and the BCBA recommendations. Question 5. Performance analysis shows that a registered behavior technician is observing a client who is exhibiting signs of distress, including furrowed brows, clenched fists, and a flushed face, and is vocalizing loudly with a strained tone. The technician is tasked with recording the client's behavior. Which of the following best represents the definition of behavior in this context? Option A. The client is being uncooperative. Option B. The client is vocalizing loudly with a strained tone, clenching fists, and exhibiting a flushed face. Option C. The client is experiencing emotional distress. Option D. The client is upset with the current task. The correct answer is C. The client is experiencing emotional distress. Explanation. This scenario presents a common implementation challenge for registered behavior technicians, RBT, where the definition of behavior, a foundational concept in applied behavior analysis, ABA, is tested in a practical, observational context. The challenge lies in accurately identifying and measuring observable, measurable actions versus internal states or interpretations. RBTs must adhere to the BAC RBT ethics code and task list, which emphasize the importance of defining behavior operationally. The correct approach represents best professional practice because it aligns directly with the BAC definition of behavior as any observable and measurable act of an individual. This approach focuses on the physical, observable actions of the client, ensuring that interventions are based on objective data. This is crucial for accurate assessment, reliable data collection, and effective treatment planning, all of which are mandated by ethical and regulatory standards for RBTs. An incorrect approach that focuses on internal states or interpretations, such as feeling frustrated or being defiant, fails to meet the criteria of being observable and measurable. These are subjective interpretations and not direct behaviors. This violates the core principle of ABA and the RBT's responsibility to collect objective data. Such an approach can lead to inaccurate assessments, ineffective interventions, and potentially harm to the client by misinterpreting their needs or actions. It also fails to adhere to the BAC requirement for operational definitions that are clear, objective, and measurable. Another incorrect approach might involve defining behavior too broadly, encompassing environmental events or the actions of others. While environmental factors are important in ABA, the definition of behavior specifically refers to the actions of the individual receiving services. Including external events as the client's behavior is a misapplication of the definition and would lead to flawed data collection and analysis. The professional decision-making process for RBTs in such situations should involve a systematic approach. 1. Recall the BAC definition of behavior, observable and measurable. 2. Analyze the observed event. Is it an action performed by the client? 3. Evaluate measurability. Can this action be counted, timed, or otherwise objectively quantified? 4. Distinguish between behavior and internal states/interpretations. Focus on what the client does, not what they might be thinking or feeling. 5. Consult the client's behavior plan and operational definitions. Ensure consistency with established protocols. 6. Seek supervision if unsure. When in doubt, always consult with a BCBA. Question 6. Operational review demonstrates that a client has reliably acquired a target skill under a continuous reinforcement schedule. The goal is now to ensure the behavior is maintained at a high rate and is resistant to extinction. Which of the following approaches best aligns with best practices for behavior maintenance? Option A. Gradually thin the reinforcement schedule to an intermittent schedule that maintains the desired response rate and promotes resistance to extinction. Option B. Discontinue reinforcement for the target behavior to assess its natural level of occurrence. Option C. Immediately switch to a very lean intermittent reinforcement schedule to maximize efficiency. Option D. Continue to provide continuous reinforcement indefinitely to ensure the behavior is always rewarded. The correct answer is A. Gradually thin the reinforcement schedule to an intermittent schedule that maintains the desired response rate and promotes resistance to extinction. Explanation. This scenario presents a common challenge in behavior analysis, balancing the need for efficient learning with the maintenance of learned behaviors. The professional is tasked with selecting the most appropriate schedule of reinforcement to ensure a client continues to perform a target behavior at a high rate without the risk of extinction. The BAC Registered Behavior Technician Certification Standards emphasize the ethical and effective application of behavior analytic principles, including the judicious use of reinforcement schedules. The correct approach involves understanding the principles of continuous and intermittent reinforcement and their impact on response rates and resistance to extinction. Continuous reinforcement, CRF, is highly effective for establishing new behaviors, but can lead to rapid extinction when reinforcement is withdrawn. Intermittent reinforcement INT schedules, while potentially slower for initial acquisition, produce more persistent behavior and greater resistance to extinction. Therefore, transitioning from CRF to an appropriate INT schedule is a best practice for behavior maintenance. An incorrect approach would be to continue using continuous reinforcement indefinitely. This is ethically problematic because it is inefficient for maintenance and can lead to the behavior ceasing if reinforcement is inadvertently missed. It also fails to adhere to best practices for promoting long-term behavioral change. Another incorrect approach would be to abruptly switch to a highly lean intermittent schedule without adequate prior exposure to less lean schedules. This could lead to a significant decrease in the behavior's rate or even extinction, which is not in the client's best interest and could be considered a failure to provide effective services. Finally, discontinuing reinforcement altogether without a clear plan or justification would be a direct violation of ethical principles and could lead to the loss of a valuable skill. Professionals should employ a systematic decision-making process that involves 1. Assessing the current status of the behavior, acquisition vs. maintenance. 2. Considering the client's goals and the function of the behavior. 3. Selecting an initial reinforcement schedule, often CRF for acquisition. 4. Systematically thinning the reinforcement schedule to an appropriate intermittent schedule once the behavior is established. And 5. Continuously monitoring the behavior to ensure it is maintained and adjusting the schedule as needed. This process ensures that interventions are data-driven, client-centered, and ethically sound, aligning with the BAC ethical code and professional standards. Question 7. Analysis of a registered behavior technician's RBT responsibilities when a client has learned to identify specific fruits in a controlled therapy setting and is now being observed in a grocery store environment. The RBT notes that the client can point to an apple when asked, but struggles to differentiate it from a pear when both are presented side by side, and also attempts to pick up a toy banana. What is the most appropriate course of action for the RBT to ensure the client's skill development is functional and safe, adhering to the principles of generalization and discrimination? Option A. Continue to prompt the client to identify the correct fruit in the grocery store setting, collecting data on their responses, and consult with the supervisor about implementing strategies to improve discrimination between similar fruits and to address the inappropriate selection of non-food items. Option B. Assume the client has generalized the skill sufficiently because they were able to identify an apple and focus on other learning objectives, relying on the caregiver to manage any instances of discrimination errors or inappropriate selections. Option C. Conclude that the skill has not generalized and discontinue further attempts to teach fruit identification in community settings until the client masters it perfectly in the therapy room. Option D. Immediately stop all fruit-related learning activities in the grocery store to avoid overwhelming the client and return to the therapy setting to reteach the basic identification of all fruits from scratch. The correct answer is A. Continue to prompt the client to identify the correct fruit in the grocery store setting, collecting data on their responses, and consult with the supervisor about implementing strategies to improve discrimination between similar fruits and to address the inappropriate selection of non-food items. Explanation. This scenario presents a professional challenge because it requires the registered behavior technician, RBT, to make a judgment call about the client's ability to generalize a learned skill to a new environment, while also considering the potential for the client to discriminate inappropriately. The RBT must balance the goal of promoting independence and functional skill use with the need to ensure safety and prevent maladaptive behaviors. This requires a deep understanding of generalization and discrimination principles, as well as the ethical obligation to provide effective and client-centered services. The correct approach represents best professional practice because it involves a systematic and data-driven assessment of generalization. By observing the client in the new environment and collecting data on their performance, the RBT can objectively determine if the skill has generalized. This aligns with the BACP ethical guidelines, which emphasize the importance of data collection and evidence-based practice. Furthermore, this approach prioritizes the client's well-being by ensuring that the skill is truly functional and not just a rote response that may lead to errors or unsafe situations in a new context. The RBT is acting as a responsible professional by verifying the skill's utility before assuming it has generalized. An incorrect approach that involves immediately assuming the skill has generalized without further assessment is professionally unacceptable. This failure to collect data and verify generalization is a direct violation of ethical standards that mandate data-driven decision-making and ensuring the efficacy of interventions. It also risks overestimating the client's capabilities, potentially leading to frustration for the client and caregivers, and undermining the progress made. Another incorrect approach, which is to discontinue teaching the skill because it hasn't been demonstrated in the new environment, is also ethically problematic. This demonstrates a lack of understanding of the generalization process, which often requires planned interventions to facilitate. It also fails to uphold the RBT's responsibility to continue working towards the client's goals and to adapt interventions as needed. This approach could be seen as abandoning the client's progress prematurely. Finally, an incorrect approach that involves solely relying on caregiver reports without direct observation and data collection is insufficient. While caregiver input is valuable, it is not a substitute for objective data. Caregiver perception can be subjective and may not accurately reflect the client's actual performance or the nuances of the skill. Ethical practice requires the RBT to be the primary data collector for skill acquisition and generalization. The professional decision-making process for similar situations should involve a clear understanding of the target behavior, the conditions under which it was taught, and the desired generalization targets. The RBT should always prioritize data collection to inform decisions. When assessing generalization, the RBT should systematically introduce the skill to new environments, people, or materials, and collect data on performance. If generalization is not occurring, the RBT should consult with their supervisor to develop strategies to promote it, rather than assuming it has or has not happened without evidence. This iterative process of assessment, intervention, and reassessment is fundamental to effective behavior analytic practice. Question 8. System analysis indicates that an RBT is implementing an extinction procedure for a client's hand-flapping behavior that occurs when the client requests a preferred item. Following the implementation of extinction, the client exhibits an immediate and significant increase in the frequency and intensity of hand flapping, along with vocalizations. The RBT observes this increase for 2 sessions. What is the most appropriate course of action for the RBT? Option A. Continue implementing the extinction procedure as planned, meticulously collecting data on the increased hand flapping and vocalizations, and prepare to discuss these observations with the supervising BCBA at the next scheduled supervision meeting. Option B. Independently decide to incorporate a differential reinforcement of other behavior, DRO, procedure alongside extinction to manage the increased hand flapping and vocalizations. Option C. Inform the client's parents that the extinction procedure is causing distress and suggest they ask the supervising BCBA to change the plan. Option D. Immediately cease the extinction procedure and revert to reinforcing the client's appropriate requests, as the extinction burst indicates the procedure is not working. The correct answer is A. Continue implementing the extinction procedure as planned, meticulously collecting data on the increased hand flapping and vocalizations, and prepare to discuss these observations with the supervising BCBA at the next scheduled supervision meeting. Explanation. This scenario presents a professional challenge because implementing extinction procedures requires careful consideration of the client's safety, the potential for extinction bursts, and the need for consistent application across all environments and individuals involved. The registered behavior technician, RBT, must balance the ethical imperative to reduce challenging behavior with the practical realities of its implementation and the potential for unintended consequences. The correct approach represents best professional practice because it prioritizes a data-driven, ethical, and collaborative implementation of extinction. This involves ensuring all stakeholders are trained and consistently applying the procedure, monitoring data to assess effectiveness and identify any adverse effects, and consulting with the supervising BCBA to make informed adjustments. This aligns with the BACP ethical code, which mandates that RBTs only practice within their scope of competence, seek supervision when necessary, and prioritize client well-being. Consistent data collection and analysis are fundamental to evidence-based practice, ensuring that interventions are effective and ethically sound. An incorrect approach that involves unilaterally discontinuing extinction due to an extinction burst without consulting the supervisor fails to adhere to the principle of seeking supervision when unsure or when encountering unexpected outcomes. This could lead to inconsistent treatment, potentially prolonging the challenging behavior or causing distress to the client. It also violates the RBT's responsibility to follow the treatment plan as designed by the BCBA and to report any significant changes or challenges. Another incorrect approach, such as modifying the extinction procedure without explicit direction from the supervising BCBA, constitutes practicing outside the scope of competence and violates the ethical requirement to implement interventions as designed by the supervisor. This can lead to ineffective or even harmful interventions. Finally, an incorrect approach that involves ignoring the extinction burst and continuing the procedure without monitoring data or seeking feedback from the supervisor is also ethically problematic. While extinction bursts are expected, they require careful observation and documentation to ensure they are temporary and to determine if the procedure remains appropriate. Failing to monitor data means the RBT cannot accurately assess the effectiveness of the intervention or identify if the client is experiencing undue distress, which is a failure to uphold the duty of care. The professional decision-making process for similar situations should involve a clear understanding of the treatment plan, a commitment to consistent implementation, diligent data collection and observation, and proactive communication with the supervising BCBA. When encountering unexpected outcomes like an extinction burst, the RBT should first document the observation thoroughly, then consult with their supervisor to discuss the data and determine the most appropriate course of action, which may involve continuing the procedure with increased vigilance, modifying the plan under supervision, or exploring alternative strategies. Question 9. The evaluation methodology shows a registered behavior technician, RBT, working with a client in a busy park when the client begins to exhibit signs of escalating distress, including increased vocalizations and agitated movements, after a peer takes a toy the client was playing with. The RBT needs to intervene effectively to manage the situation. Which of the following actions best reflects appropriate crisis management and de-escalation techniques for an RBT in this scenario? Option A. Immediately attempt to physically redirect the client to a quieter area and offer a preferred item to distract them. Option B. Inform the client that their behavior is unacceptable and that they will be removed from the park if it continues. Option C. Remain calm, use a soft tone of voice, acknowledge the client's distress, and attempt to understand the antecedent by asking what happened while maintaining a safe distance. Option D. Leave the client to find a supervisor, assuming the situation will resolve on its own. The correct answer is A. Immediately attempt to physically redirect the client to a quieter area and offer a preferred item to distract them. Explanation. This scenario presents a common challenge in behavior technician practice, managing a client's escalating distress in a public setting. The professional difficulty lies in balancing the client's immediate need for support and safety with the need to maintain a safe and appropriate environment for others, all while adhering to ethical guidelines and the BACP Registered Behavior Technician (RBT) standards. The RBT must act swiftly and effectively to de-escalate the situation without resorting to punitive measures or compromising the client's dignity. The correct approach prioritizes de-escalation through empathetic communication and redirection, aligning with the RBT's ethical responsibility to provide services in a manner that is least restrictive and most beneficial to the client. This approach is grounded in the BACP Ethical Code for Behavior Analysts and RBTs, which emphasizes client dignity, beneficence, and avoiding harm. Specifically, it reflects the principles of maintaining client rights and ensuring that interventions are implemented in a way that respects the individual. By focusing on understanding the antecedent triggers and providing a calm, supportive response, the RBT is actively working to reduce the intensity of the behavior and prevent further escalation, which is a core competency for RBTs. An incorrect approach that involves immediately attempting to physically restrain the client without first attempting de-escalation is ethically problematic. This could be interpreted as a failure to implement least restrictive procedures and may violate the client's right to dignity and autonomy. Such an action could also be seen as a punitive response rather than a therapeutic one, which is contrary to the principles of applied behavior analysis. Furthermore, failing to involve a supervisor or qualified professional when a situation exceeds the RBT's training or comfort level is a significant ethical lapse. The RBT has a responsibility to seek guidance when faced with a crisis that they are not adequately equipped to handle, as outlined in the RBT standards regarding supervision and scope of practice. Another incorrect approach, such as ignoring the behavior or leaving the client unattended during a crisis, would be a direct violation of the duty of care and could place both the client and others at risk, demonstrating a failure to act in the client's best interest and a disregard for safety protocols. Professional decision-making in such situations requires a systematic approach. First, assess the immediate safety of the client and others. Second, attempt de-escalation strategies using verbal techniques and environmental modifications. Third, if de-escalation is unsuccessful, implement predetermined crisis intervention plans, which may involve seeking assistance from supervisors or other trained personnel. And finally, document the incident thoroughly and debrief with the supervisor to identify learning opportunities and refine future crisis management strategies. Question 10. Research into a client's persistent hand-flapping behavior reveals that it occurs most frequently during transitions between activities and is often followed by increased attention from caregivers. The RBT suspects the behavior is maintained by attention, but the client also exhibits increased hand flapping when feeling overstimulated by sensory input. The RBT is unsure whether to focus on antecedent manipulation to reduce sensory overload or consequence manipulation to decrease attention seeking. What is the most appropriate course of action for the RBT? Option A. Focus solely on reducing sensory input by creating a quieter environment, as the RBT believes sensory overload is the primary driver of the hand flapping. Option B. Systematically collect data on the frequency and duration of hand flapping across various antecedent conditions, e.g., during transitions, during quiet time, during sensory-rich environments, and the immediate consequences, e.g., caregiver attention, self-soothing, to develop a clearer functional hypothesis, then present this data and hypothesis to the supervising BCBA for intervention planning. Option C. Immediately implement a differential reinforcement of other behavior (DRO) procedure to reduce the hand flapping, assuming it is attention-seeking, and observe if the behavior decreases. Option D. Begin prompting the client to engage in alternative, more appropriate behaviors during transitions and when they appear overstimulated, without first collecting further data on the specific function of the hand flapping. Correct answer is B. Systematically collect data on the frequency and duration of hand flapping across various antecedent conditions, e.g., during transitions, during quiet time, during sensory-rich environments, and the immediate consequences, e.g., caregiver attention, self-soothing, to develop a clearer functional hypothesis, then present this data and hypothesis to the supervising BCBA for intervention planning. Explanation. This scenario presents a common implementation challenge for registered behavior technicians, RBT, where a client's behavior is influenced by a complex interplay of antecedents and consequences that are not immediately obvious or easily manipulated. The challenge lies in accurately identifying the function of the behavior and selecting an intervention that is both effective and ethically sound. Adhering strictly to the BACP RBT task list and ethical code, the correct approach involves a systematic, data-driven process of observation, hypothesis testing, and intervention development. This aligns with best professional practice by prioritizing client well-being and evidence-based interventions. Specifically, it requires the RBT to 1. Meticulously collect data on antecedents and consequences to form a functional hypothesis. 2. Collaborate with the supervising BCBA to refine this hypothesis and develop an intervention plan. And 3. Implement the plan consistently while continuing to collect data for ongoing evaluation. This process ensures that interventions are directly linked to the identified function of the behavior, maximizing effectiveness and minimizing the risk of unintended negative consequences. This adherence to data collection, hypothesis formation, and supervised intervention aligns with the ethical principles of beneficence and non-maleficence, as well as the RBT's responsibility to work under the direction of a BCBA. Incorrect approaches fail to uphold these standards. One incorrect approach might involve making assumptions about the behavior's function based on superficial observations or anecdotal evidence, without systematic data collection. This violates the principle of evidence-based practice and can lead to ineffective or even harmful interventions. Ethically, it demonstrates a lack of diligence and a failure to adhere to the RBT's scope of practice, which mandates data-driven decision-making under supervision. Another incorrect approach could be to implement an intervention without a clear understanding of the antecedent-consequence relationship, or to modify the intervention without consulting the supervising BCBA. This bypasses the crucial supervisory component, which is a cornerstone of RBT practice and essential for ensuring client safety and intervention integrity. Such actions could be considered a breach of ethical guidelines regarding scope of practice and supervision. The professional reasoning process for such situations involves a commitment to the RBT's ethical code and task list. When faced with a challenging behavior, an RBT should first focus on accurate and objective data collection related to antecedents and consequences. This data should then be used to formulate a preliminary hypothesis about the behavior's function. The next critical step is to communicate these findings and hypotheses to the supervising BCBA, who will guide the refinement of the hypothesis and the development or modification of the intervention plan. The RBT's role is to implement the plan faithfully and continue to monitor its effectiveness through ongoing data collection, reporting any changes or challenges back to the supervisor. This iterative, collaborative, and data-informed process ensures that interventions are appropriate, effective, and ethically delivered. Question 11. The monitoring system demonstrates that a registered behavior technician is reviewing data collected during an observation period. Which of the following best describes the primary purpose of this data collection within the context of a functional behavior assessment, FBA? Option A. To identify the specific environmental events that trigger and maintain the target behavior, thereby informing the hypothesis about its function. Option B. To implement immediate strategies to suppress the target behavior as quickly as possible. Option C. To simply record the frequency and duration of the target behavior for reporting purposes. Option D. To confirm the presence of a behavior pattern consistent with the client's diagnostic label. The correct answer is A. To identify the specific environmental events that trigger and maintain the target behavior, thereby informing the hypothesis about its function. Explanation. This scenario presents a professional challenge because it requires the registered behavior technician, RBT, to accurately interpret and apply the foundational principles of a functional behavior assessment, FBA, in a practical setting. The RBT must discern the core purpose of an FBA and its essential components to ensure effective intervention planning and client care, adhering strictly to the BACP RBT certification requirements. The correct approach represents best professional practice because it accurately identifies the primary purpose of an FBA, to understand the function of a behavior. This understanding is crucial for developing effective, individualized behavior intervention plans, BIP, that address the underlying reasons for the behavior rather than just its surface-level manifestations. The back task list for RBTs emphasizes the importance of understanding behavior functions as a prerequisite for data collection and intervention implementation. This approach aligns with ethical guidelines that mandate data-driven decision-making and client-centered care. An incorrect approach that focuses solely on collecting data without understanding its purpose fails to grasp the essence of an FBA. The BACP RBT standards require RBTs to assist in implementing behavior change strategies, which necessitates understanding the why behind the behavior. Simply recording occurrences without a functional hypothesis is insufficient and may lead to ineffective or even harmful interventions. This approach violates the ethical principle of providing competent services. Another incorrect approach that prioritizes immediate behavior reduction over understanding the function is also professionally unacceptable. A behavior reduction is often a goal. An FBA's purpose is to identify the function to achieve sustainable and meaningful change. Focusing solely on reduction without understanding the function can lead to superficial changes or the replacement of one problem behavior with another, without addressing the root cause. This can be considered a failure to adhere to the principle of promoting client dignity and well-being. A third incorrect approach that emphasizes the client's diagnosis over the specific behavior's function misses the individualized nature of behavior analysis. While diagnoses can inform potential behavioral patterns, an FBA must focus on the specific behavior exhibited by the individual in their unique environment. Relying solely on a diagnosis for intervention planning bypasses the critical data collection and analysis required by the BACP standards and can lead to generalized, ineffective interventions. This represents a failure to conduct a thorough and individualized assessment. The professional decision-making process for similar situations should involve a clear understanding of the RBT's role in the assessment process, which is to assist in conducting assessments and implementing interventions under the supervision of a BCBA. When faced with interpreting assessment information, the RBT should always refer back to the core principles of behavior analysis, particularly the concept of behavior function, as outlined in the BACP task list and ethical code. If there is any ambiguity, seeking clarification from the supervising BCBA is paramount to ensure adherence to best practices and regulatory requirements. Question 12. Compliance review shows that 2 registered behavior technicians, RBT, have been collecting data on the frequency of a client's self-injurious behavior during discrete trial training sessions. While reviewing their session notes, a supervisor notices that both RBTs recorded a total of 15 instances of the behavior over a week. However, the supervisor needs to ensure the reliability of this data. Which of the following best represents the most appropriate method for the supervisor to assess the consistency of the RBTS observations? Option A. Compare the total number of observed instances of the behavior recorded by each RBT for the entire week. Option B. Ask the RBTs to verbally confirm that they both observed the same general level of the behavior. Option C. Review the RBTS operational definition of self-injurious behavior to ensure it is clear. Option D. Calculate the percentage of agreement between the 2 RBTS recorded instances of the behavior across all sessions. The correct answer is D. Calculate the percentage of agreement between the 2 RBTS recorded instances of the behavior across all sessions. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis where ensuring the reliability of data collection is paramount. The professional challenge lies in accurately assessing the consistency of observations between 2 technicians, which directly impacts the validity of the intervention and the client's progress. Without a robust understanding of inter-observer agreement, IOA, a behavior technician might misinterpret data, leading to ineffective treatment plans or even harm to the client. Correct approach analysis. The correct approach involves calculating a measure of agreement that reflects the degree to which 2 observers' data align. This aligns with the BACP Registered Behavior Technician Handbook, which emphasizes the importance of reliable data collection. A common and appropriate method for calculating IOA for discrete trial training data, such as the frequency of a specific behavior, is to use a percentage of agreement. This method directly quantifies the overlap in observed instances of the target behavior, providing a clear indication of whether the observers are consistently identifying and recording the behavior. This ensures that the data collected is trustworthy and can be used to make informed decisions about the client's treatment. Incorrect approach is analysis. One incorrect approach involves solely relying on the subjective impression of agreement without any quantitative measure. This fails to meet the BACT requirement for objective data collection and verification. It is ethically problematic because it introduces bias and lacks the rigor necessary to ensure client welfare. Another incorrect approach might involve calculating agreement only on the total count of the behavior, without considering the timing or specific instances. This is insufficient because two observers could arrive at the same total count by observing different occurrences of the behavior, leading to a false sense of agreement. This approach lacks the precision required for reliable data and could lead to misinterpretations of the intervention's effectiveness. A third incorrect approach could be to use a complex statistical formula not typically employed for basic IOA calculation in RBT practice, or to use a method that is inappropriate for the type of data being collected, e.g., using a duration-based IOA for frequency data. This demonstrates a lack of understanding of fundamental RBT competencies and could lead to inaccurate assessments of data reliability, potentially violating ethical standards related to competence and data integrity. Professional reasoning. When faced with assessing inter-observer agreement, a behavior technician should first identify the type of data being collected, e.g., frequency, duration, interval. Then they should select an appropriate and commonly accepted IOA method for that data type, as outlined in RBT training materials and BACT guidelines. The technician should then meticulously collect the data from both observers and apply the chosen calculation method. Finally, they should interpret the resulting agreement score in the context of established benchmarks for acceptable IOA, and if agreement is low, investigate the reasons for disagreement and implement corrective actions, such as retraining or clarifying operational definitions. Question 13. Which approach would be most effective in determining the function of a client's disruptive vocalizations during academic tasks, considering the RBT's role in direct observation and data collection? Option A. Systematically observe and record the antecedents and consequences associated with the disruptive vocalizations, and use this data to hypothesize the function. Option B. Implement a consequence that immediately stops the vocalization, such as a verbal reprimand, without further investigation. Option C. Rely primarily on the caregiver's statement that the client is seeking attention when the vocalizations occur. Option D. Assume the vocalizations are for sensory stimulation and introduce a sensory-based intervention without observing the behavior in context. The correct answer is A. Systematically observe and record the antecedents and consequences associated with the disruptive vocalizations, and use this data to hypothesize the function. Explanation. This scenario is professionally challenging because accurately identifying the function of a behavior is foundational to effective intervention, and misidentification can lead to ineffective or even harmful treatment plans. The registered behavior technician, RBT, must rely on direct observation and data collection to infer the function, rather than assumptions or anecdotal evidence. Careful judgment is required to differentiate between the four primary functions: escape, attention, access to tangibles, and sensory. The correct approach represents best professional practice because it prioritizes data-driven decision-making and adherence to the BACT RBT ethics code. Specifically, it aligns with the ethical principle of providing competent services and the requirement to base interventions on the identified function of behavior. By systematically observing and recording antecedents and consequences, the RBT can gather objective data to hypothesize the function, which then guides the development of an appropriate behavior intervention plan. This approach ensures that interventions are directly addressing the underlying reason for the behavior, increasing the likelihood of positive outcomes and skill acquisition. An incorrect approach that relies solely on caregiver reports without direct observation fails to meet ethical standards for data collection and intervention planning. The BACT RBT Ethics Code emphasizes the importance of objective measurement and data-based decision-making. Caregiver reports can be subjective and influenced by biases, leading to an inaccurate functional assessment. Interventions based on such assumptions are unlikely to be effective and may even inadvertently reinforce the behavior. Another incorrect approach that focuses on punishment-based strategies without first identifying the function of the behavior is ethically problematic and often ineffective. The BACT guidelines advocate for positive behavior support and least restrictive interventions. Punishment without understanding the function can suppress behavior temporarily, but does not teach alternative, appropriate behaviors and can lead to negative side effects. Lastly, an approach that assumes a sensory function without ruling out other more socially mediated functions, escape, attention, tangibles, is premature and can lead to an inefficient and inappropriate intervention plan. While sensory consequences can maintain behavior, it's crucial to exhaust other possibilities through systematic observation and data analysis. Professionals should use a decision-making framework that begins with a clear understanding of the target behavior and the context in which it occurs. This involves conducting a functional assessment, which includes direct observation, ABC data collection, antecedent, behavior, consequence, and potentially interviews. Based on this data, the RBT, in collaboration with a BCBA, will hypothesize the function of the behavior. The intervention plan will then be designed to address that specific function by teaching replacement behaviors and modifying environmental variables. Regular data collection and analysis are essential to monitor the effectiveness of the intervention and make necessary adjustments, always prioritizing ethical guidelines and client well-being. Question 14. The review process indicates that a registered behavior technician is collecting data on a client's tantrum behavior. The client's parents are concerned about how long the tantrums last, as they significantly disrupt family activities. The technician is considering different measurement systems to track this behavior. Which measurement system would be most appropriate to capture the parent's primary concern and inform intervention effectiveness? Option A, response time. Option B, latency. Option C, frequency. Option D, duration. The correct answer is D, duration. Explanation. This scenario presents a common challenge in behavior analysis, selecting the most appropriate measurement system to capture the essence of a target behavior for effective intervention. The challenge lies in accurately reflecting the behavior's occurrence and its impact on the individual's functioning, which directly informs intervention design and progress monitoring. Careful judgment is required to ensure the chosen measurement method is sensitive to changes resulting from intervention and aligns with ethical and regulatory standards for data collection. The correct approach accurately captures the temporal aspect of the behavior, providing a nuanced understanding of its occurrence. This method is best professional practice because it allows for precise tracking of how long a behavior lasts, which is crucial for behaviors where the duration, not just the frequency, is the primary concern for intervention. For instance, if the goal is to reduce the time a child engages in self-stimulatory behavior, duration is the most relevant measure. This aligns with the BACP emphasis on data-driven decision-making and the ethical obligation to use measurement systems that are valid and reliable for the target behavior and intervention goals. An incorrect approach that focuses solely on counting occurrences without considering the time elapsed between them fails to capture critical information. This is a regulatory and ethical failure because it can lead to an incomplete or misleading picture of the behavior's impact and the effectiveness of interventions. For example, if a behavior occurs very frequently but for very short durations, a frequency count alone might suggest a significant problem, while a duration measure might reveal it's less impactful than initially perceived. This can result in misdirected interventions and wasted resources, violating the principle of providing effective services. Another incorrect approach that measures the time from a stimulus to the initiation of a response is also a regulatory and ethical failure if it's applied to a behavior where the duration of the behavior itself is the target. Latency is appropriate for measuring reaction time, or the time it takes to start a behavior, not how long the behavior lasts. Using latency when duration is the relevant metric leads to inaccurate data collection and flawed intervention planning, potentially harming the client by not addressing the actual problem behavior effectively. This misapplication of measurement principles is a breach of professional competence and ethical responsibility. A professional decision-making process for similar situations should involve a thorough functional assessment of the behavior, clearly defined target behaviors, and a consideration of the intervention goals. Professionals must ask, what aspect of this behavior is most important to change, and which measurement system will best capture that aspect and allow us to track progress towards the goal. This systematic approach ensures that data collection is purposeful, ethical, and directly supports effective service delivery, adhering to the rigorous standards set by the certifying body. Question 15. The analysis reveals that a registered behavior technician is tasked with collecting data on a client's hand-flapping behavior, which is characterized by distinct starts and stops and occurs approximately 10-15 times per hour during structured activities. The technician needs to accurately track the frequency of this behavior to assess the effectiveness of an intervention aimed at reducing it. Which data collection method would be most appropriate and why? Option A, whole interval time sampling. Option B, permanent product recording. Option C, event recording. Option D, momentary time sampling. The correct answer is C, event recording. Explanation. This scenario presents a common challenge in behavior analysis, selecting the most appropriate data collection method to accurately capture the target behavior's occurrence and intensity within a specific context. The professional must consider the nature of the behavior, the resources available, and the ultimate purpose of the data collection. The correct approach represents best professional practice because it aligns with the principles of accurate and efficient data collection as outlined by the BAC, Behavior Analyst Certification Board, Registered Behavior Technician, RBT standards. Event recording is ideal for behaviors that are discrete, have a clear beginning and end, and occur at a relatively low frequency, allowing for precise measurement of each instance. This method provides a direct count of the behavior, which is crucial for understanding its baseline and the impact of interventions. An incorrect approach would be to use time sampling for a behavior that is very brief and has a clear start and end, as this method might miss instances of the behavior if it does not occur during the observation interval, leading to an underestimation of its frequency. Relying solely on permanent product for a behavior that is not easily captured by its outcome, or where the outcome is not consistently produced, would also be a failure. For example, if the target behavior is a verbal outburst, the permanent product e.g., a written note about the outburst, is a secondary artifact and not a direct measure of the behavior itself, potentially leading to inaccurate data. Using time sampling for a behavior that occurs very frequently and is easily observable would be inefficient and less precise than event recording. Professionals should employ a decision-making framework that begins with clearly defining the target behavior. Next, they should consider the behavior's characteristics, frequency, duration, intensity, and discreteness. Then, they evaluate the feasibility and efficiency of different data collection methods in the given setting and with available resources. Finally, they select the method that will yield the most accurate, reliable, and relevant data for the intervention goals, ensuring compliance with RBT ethical standards. Question 16. The audit findings indicate that antecedent modifications designed to increase on-task behavior for a client with ADHD are not being implemented with consistent fidelity, leading to a decrease in observed on-task instances. The Registered Behavior Technician, RBT, has been implementing the plan as initially trained, but notes that the client's engagement fluctuates significantly. Which of the following actions best reflects the appropriate professional response to these audit findings? Option A. The RBT should inform the supervising BCBA/BCA that the audit findings are likely due to the client's inherent variability in attention and that no changes to the plan are warranted. Option B. The RBT should consult with the supervising BCBA/BCA to review the data, discuss the observed implementation challenges, and collaboratively determine if adjustments to the antecedent modifications are necessary. Option C. The RBT should independently adjust the timing and intensity of the antecedent modifications based on their professional judgment of the client's fluctuating engagement levels. Option D. The RBT should focus solely on reinforcing any instances of on-task behavior observed, regardless of the consistent implementation of the antecedent modifications. The correct answer is B. The RBT should consult with the supervising BCBA/BCA to review the data, discuss the observed implementation challenges, and collaboratively determine if adjustments to the antecedent modifications are necessary. Explanation. The scenario presents a common challenge in behavior technician practice, ensuring that antecedent modifications are implemented consistently and effectively as observed during an audit. The professional challenge lies in balancing the need for fidelity to the behavior intervention plan, BIP, with the dynamic nature of client needs and the practicalities of implementation in real-world settings. Careful judgment is required to determine if observed deviations from the BIP constitute a minor adjustment or a significant breach of protocol that could impact treatment efficacy and client safety. The correct approach represents best professional practice because it directly addresses the audit finding by focusing on the systematic review and adjustment of antecedent strategies based on data and supervision. This aligns with the ethical obligation to provide effective services and the regulatory requirement to adhere to the principles of applied behavior analysis, ABA, as outlined by the Behavior Analyst Certification Board, BAC, for Registered Behavior Technicians, RBT. Specifically, RBTs are trained to implement behavior change strategies and data collection under the supervision of a BCBA or BCA. When an audit reveals issues with antecedent modifications, the most professional and ethical response is to engage in a collaborative process with the supervising BCBA/BCA to analyze the data, identify the root cause of the implementation challenges, and revise the antecedent strategies as needed. This ensures that interventions remain evidence-based, client-centered, and aligned with the BIP. An incorrect approach that involves unilaterally altering antecedent modifications without consulting the supervisor is a significant regulatory and ethical failure. RBTs are not authorized to independently change intervention plans. This action violates the RBT scope of practice, which mandates that RBTs implement interventions as designed by the supervising BCBA/BCA and seek clarification or modification approval from them. Such unilateral changes can lead to a breakdown in the integrity of the intervention, potentially resulting in decreased effectiveness, increased challenging behaviors, and a failure to meet client progress goals. It also undermines the supervisory relationship and the structured system of ABA service delivery. Another incorrect approach, such as dismissing the audit findings as insignificant without further investigation, is also professionally unacceptable. This demonstrates a lack of commitment to quality assurance and continuous improvement, which are fundamental to ethical ABA practice. Ignoring audit findings can lead to the perpetuation of ineffective or potentially harmful practices, failing to uphold the responsibility to provide competent services. It also neglects the opportunity to refine antecedent strategies, which are crucial for proactive behavior management. A third incorrect approach, such as solely focusing on the client's immediate compliance without analyzing the underlying effectiveness of the antecedent modification, misses the core principle of ABA. While immediate compliance is often a goal, the effectiveness of an antecedent modification is determined by its impact on reducing the likelihood of challenging behavior and increasing the likelihood of desired behaviors over time. This approach fails to engage in the data-driven decision-making that is central to ABA and the RBT's role. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and thoroughly review audit findings. 2. Collect and analyze relevant data related to the antecedent modifications in question. 3. Consult with the supervising BCBA/BCA to discuss the findings, data, and potential reasons for implementation challenges. 4. Collaboratively develop and implement a plan to revise or reinforce antecedent modifications based on the analysis and supervision. 5. Continue to monitor data and seek ongoing supervision to ensure fidelity and effectiveness. Question 17. The evaluation methodology shows that a client exhibits several behaviors that are causing concern for their caregivers and educators. These include frequent, loud vocalizations that disrupt group activities, occasional hand flapping when excited, and a tendency to grab items from others without asking. The supervising behavior analyst needs to identify target behaviors for reduction. Which of the following approaches best aligns with ethical and professional standards for identifying target behaviors for reduction? Option A. Focus on behaviors that are most disruptive to the classroom environment or that are most frequently reported as annoying by caregivers, regardless of their impact on the client's own functioning. Option B. Prioritize behaviors that pose a significant safety risk to the client or others, or that severely impede the client's ability to learn or engage in socially meaningful activities. Option C. Target behaviors that are considered undesirable by societal norms, even if the client's caregivers do not express significant concern about them. Option D. Select behaviors that are easily observable and measurable, even if they do not appear to have a significant negative impact on the client's quality of life or social integration. Correct answer is B. Prioritize behaviors that pose a significant safety risk to the client or others, or that severely impede the client's ability to learn or engage in socially meaningful activities. Explanation. This scenario presents a common challenge in behavior analysis, selecting appropriate target behaviors for reduction that are both ethically sound and functionally relevant to the client's well-being and integration into their environment. The professional must balance the need to address problematic behaviors with the imperative to avoid targeting behaviors that are merely aversive to others or that do not significantly impede the client's progress or safety. Careful judgment is required to ensure interventions are client-centered and adhere to professional standards. The correct approach represents best professional practice because it prioritizes behaviors that are directly linked to safety risks or significant social exclusion, aligning with the ethical principles of beneficence and non-maleficence. Identifying behaviors that interfere with learning or social participation ensures that interventions are functional and aimed at improving the client's quality of life. This aligns with the CertMedbry ethics code, which emphasizes the importance of client welfare and the selection of target behaviors that are socially significant. An incorrect approach that focuses solely on behaviors that are disruptive to others, without considering their impact on the client's own functioning or safety, fails to uphold the principle of client-centered care. This could lead to interventions that are punitive rather than helpful, and may not address the underlying function of the behavior. Such an approach could violate ethical guidelines by prioritizing the convenience of others over the client's needs, and potentially leading to the suppression of behaviors without improving the client's adaptive skills. Another incorrect approach that targets behaviors that are not clearly defined or measurable makes it impossible to accurately track progress or determine the effectiveness of interventions. This lack of precision can lead to inconsistent application of procedures and a failure to provide evidence-based services, which is a violation of professional standards. Furthermore, targeting behaviors that are not functionally related to the client's goals or that are simply idiosyncratic preferences of others, without a clear benefit to the client, is ethically questionable and may not be considered socially valid. The professional decision-making process for similar situations should involve a thorough functional assessment to understand the purpose of the behavior. This includes direct observation, interviews with stakeholders, and consideration of the client's environment and goals. The selection of target behaviors should be a collaborative process, involving the client to the extent possible, their caregivers, and the supervising BCBA, ensuring that the chosen behaviors are socially valid, measurable, and directly contribute to the client's improved functioning and well-being. Prioritizing safety and social integration are key ethical considerations. Question 18. During the evaluation of a client's behavior, a registered behavior technician is tasked with identifying target behaviors for intervention. The technician observes the client exhibiting behaviors such as increased vocalizations, pacing, and hand flapping. The client's parent reports that the client seems frustrated when these behaviors occur. Which of the following represents the most appropriate identification of observable behaviors for intervention? Option A, the client's frustration. Option B, the parent's perception of the client's feelings. Option C, increased vocalizations, pacing, and hand flapping. Option D, the client's internal emotional state. The correct answer is C. Increased vocalizations, pacing, and hand flapping. Explanation. This scenario presents a common challenge in behavior analysis, distinguishing between behaviors that can be directly observed and measured versus those that are internal and inferred. The registered behavior technician, RBT, must accurately identify and define target behaviors for intervention. Misclassifying a behavior can lead to ineffective treatment plans, inaccurate data collection, and ultimately, a failure to support the client's progress. The correct approach involves identifying behaviors that are directly observable and measurable. This aligns with the fundamental principles of behavior analysis, which emphasize objective measurement of behavior. The CertMedbry task list, which serves as the primary regulatory framework for this certification, stresses the importance of defining target behaviors in observable and measurable terms. This ensures that progress can be objectively tracked and that interventions are applied consistently. An incorrect approach would be to focus on internal states or subjective experiences that cannot be directly verified. For instance, defining a target behavior as feeling sad is problematic because sadness is an internal emotional state, not a directly observable action. While observable behaviors like crying or withdrawal might be associated with sadness, the internal feeling itself is not measurable. violates the core principle of operationalizing behaviors for objective assessment and intervention, as mandated by the RBT certification standards. Another incorrect approach might be to define a behavior too broadly, encompassing a range of actions that are not specific enough for consistent measurement. For example, defining aggression without specifying the exact actions, e.g., hitting, kicking, biting, makes it difficult for different observers to agree on whether the behavior has occurred. This lack of precision hinders reliable data collection and intervention fidelity. Professionals should approach such situations by first understanding the definition of a behavior according to applied behavior analysis principles. They should ask, can I see it? Can I count it? Can I measure it? If the answer is no, the behavior needs to be redefined in terms of observable actions. This systematic process ensures that interventions are grounded in empirical evidence and that the RBT is collecting reliable and valid data to inform treatment decisions, adhering to the ethical and regulatory standards set forth by the BAC. Question 19. The monitoring system demonstrates that the behavior analyst is considering indirect assessment methods to gather information on a client's challenging behavior. Which of the following approaches would best align with the Registered Behavior Technician Certification Standards for effective and ethical indirect assessment? Option A. Conducting a structured interview with the client's primary caregiver, focusing on specific antecedents, behaviors, and consequences. Option B. Utilizing a pre-existing generic questionnaire designed for a broad range of behavioral concerns. Option C. Sending a general, unguided questionnaire to all extended family members without prior consultation. Option D. Having a brief, informal chat with the client's teacher about their general observations. The correct answer is A. Conducting a structured interview with the client's primary caregiver, focusing on specific antecedents, behaviors, and consequences. Explanation. This scenario presents a common challenge in behavior analysis, gathering comprehensive information about a client's behavior in a way that is both efficient and ethically sound, adhering strictly to the Registered Behavior Technician Certification Standards. The challenge lies in selecting the most appropriate indirect assessment method when multiple options are available, ensuring the information gathered is relevant, reliable, and respects client confidentiality and autonomy. Careful judgment is required to balance the need for data with the practicalities of implementation and the potential for bias inherent in indirect methods. The correct approach involves utilizing a structured interview with the primary caregiver, focusing on specific target behaviors and their antecedents and consequences. This represents best professional practice because interviews, when conducted systematically, allow for direct questioning and clarification, providing richer, context-specific information than a general questionnaire might. The Registered Behavior Technician Code of Ethics emphasizes obtaining information from reliable sources and using methods that are appropriate for the client's needs and the assessment goals. A structured interview, guided by established behavioral principles, is a recognized and effective indirect assessment method that aligns with these ethical guidelines. It allows the RBT to probe for details and understand the nuances of the behavior within its natural environment, which is crucial for developing an effective intervention plan. An incorrect approach would be to rely solely on a broad, unguided questionnaire sent to multiple family members without prior discussion. This is professionally unacceptable because unguided questionnaires can lead to vague or irrelevant responses, increasing the risk of misinterpretation and potentially violating client confidentiality if not handled with extreme care regarding distribution and data storage. Furthermore, the lack of opportunity for clarification means the RBT cannot ensure the information gathered is accurate or directly applicable to the target behaviors. Another incorrect approach would be to conduct a brief, informal chat with the client's teacher without a specific agenda or structured questions. This is ethically problematic as it may not yield sufficient or reliable data, potentially leading to an incomplete or inaccurate assessment. The RBT Code of Ethics mandates thorough and systematic assessments, and informal conversations often lack the rigor required. Relying on a pre-existing, generic questionnaire that was not tailored to the specific client's needs or target behaviors is also an unacceptable approach. This fails to meet the ethical obligation to conduct individualized assessments and may result in the collection of data that is not relevant or useful for developing an effective intervention plan. The professional reasoning process should involve first identifying the assessment goals and the target behaviors, then Consider the available resources and the most appropriate individuals to provide information. Structured interviews with primary caregivers are often the most effective starting point for indirect assessment due to their direct involvement and knowledge of the client's daily life. If further information is needed, more targeted questionnaires or interviews with other relevant parties, e.g., teachers, therapists, can be considered, always ensuring the methods are systematic and ethically sound. Question 20. Benchmark analysis indicates that a registered behavior technician is working with a client who exhibits a specific verbal request for a preferred item. The technician observes that the client makes this request more frequently when a particular toy is visible in the room, but the toy is also present at other times when the client does not make the request. Reinforcement, receiving the item, is consistently delivered when the request is made and the toy is visible. The technician needs to determine the function of the visible toy in relation to the client's verbal request. Which of the following best describes the appropriate analysis and conclusion regarding the toy's role? Option A. The toy is functioning as a discriminative stimulus, SD, for the verbal request because the client mentions the toy when making the request. Option B. The toy is functioning as a discriminative stimulus, SD, for the verbal request because the toy is present in the environment when the behavior occurs. Option C. The toy is functioning as a discriminative stimulus, SD, for the verbal request because the behavior occurs more often in its presence, and reinforcement is consistently delivered when the behavior occurs in its presence. Option D. The toy is functioning as a discriminative stimulus, SD, for the verbal request because the client appears to enjoy playing with the toy. Correct answer is C. The toy is functioning as a discriminative stimulus, SD, for the verbal request because the behavior occurs more often in its presence, and reinforcement is consistently delivered when the behavior occurs in its presence. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis, where a behavior technician must accurately identify and respond to the controlling variables of a target behavior. The difficulty lies in distinguishing between a stimulus that reliably signals reinforcement availability, a discriminative stimulus, or SD, and a stimulus that is merely present during the behavior or is a condition punisher. Misidentifying the SD can lead to ineffective intervention, wasted session time, and potentially the extinction or punishment of the behavior when reinforcement is actually available. This requires careful observation, data collection, and understanding of stimulus control principles as outlined by the back. Correct approach analysis. The correct approach involves systematically evaluating the relationship between the stimulus and the behavior. This means observing when the behavior occurs and when it does not, and specifically noting the presence or absence of the stimulus in question. If the behavior occurs more frequently in the presence of the stimulus and less frequently in its absence, and if reinforcement is consistently delivered following the behavior when the stimulus is present, then it is likely an SD. This systematic evaluation aligns with the back emphasis on data-driven decision-making and accurate functional assessment, ensuring interventions are based on empirically demonstrated stimulus control. Incorrect approaches analysis. One incorrect approach would be to assume the stimulus is an SD based solely on its frequent co-occurrence with the behavior, without verifying if reinforcement is contingent on the behavior in its presence. This fails to establish functional stimulus control and violates the principle of differential reinforcement, as it might lead to reinforcement being delivered even when the stimulus is absent, thus weakening its discriminative function. This also risks reinforcing the behavior under inappropriate conditions, which is ethically questionable and professionally unsound according to BACP standards. Another incorrect approach would be to immediately withdraw the stimulus or attempt to extinguish the behavior upon observing its presence, without first confirming its role as an SD. This could inadvertently punish a behavior that is actually being signaled for reinforcement, leading to a decrease in the desired behavior and potential frustration for the client. This approach demonstrates a lack of systematic assessment and a failure to adhere to the principles of behavior analysis, potentially causing harm or hindering progress, which is a direct contravention of ethical guidelines. A third incorrect approach would be to rely on anecdotal evidence or the client's verbal report alone to identify the SD, without objective observation and data collection. While client input is valuable, it must be corroborated with behavioral data. This approach bypasses the rigorous empirical process required for establishing stimulus control and can lead to misinterpretations and ineffective treatment plans, violating the BACT requirement for evidence-based practice. Professional reasoning. Professionals should approach this situation by first defining the target behavior and the potential stimulus. Then, they should implement an observational plan to collect data on the frequency of the behavior in the presence and absence of the stimulus. This data should be analyzed to determine if the stimulus reliably predicts the availability of reinforcement for the behavior. If the data supports stimulus control, the technician can then proceed with interventions that utilize the stimulus as an SD. If the data does not support stimulus control, further assessment or modification of the intervention is necessary. This systematic, data-driven process ensures ethical and effective service delivery, aligning with the BACT registered behavior technician standards.